Okay, so what happens in this problem we just talked about, which is the early triggering? The patient basically is not receiving enough volume or enough flow rate to treat his air hunger. The patient is in air hunger looking for more volume of air, which could be secondary to severe metabolic acidosis, pain, agitation, some CNS injury. So the patient feel that it needs more air, so will try to trigger the ventilator for more to come. But again, the ventilator here is unresponsive. This will lead that the patient is not getting the desired volume, and that's why it's trying to breathe more to get that volume. This will lead to significant dyssynchrony and significant increased work of breathing. This will make things worse, not better. So how to solve? The first thing is treat these underlying problems. Treat his acidosis, manage his pain properly, manage his agitation, give him proper sedation, and treat this problem if it's treatable. That's one thing. On the other hand, what you could do, if you are doing VC, volume control mode, simply you can decrease inspiratory time by increasing flow rate. That way you will deliver the volume the patient need faster, and this will allow to proper triggering rather than early triggering and all this desynchronization. The other option, so if you giving, let's say, 40 liter per minute, you can increase it to 50 or 60. So that's one possibility. Also, sometimes increasing respiratory rate will help, because that will decrease respiratory cycle and decrease inspiratory time as well. But the easier way and easier solution, I think, is switch to pressure control mode, because here the patient will have more liberty to pull his tidal volume. So this will be really good in metabolic acidosis, because here the target is a pressure and the flow is variable. So the patient can go up and down in the flow, as you know by now, should know by now, all of this. We have to be careful. Remember, always there is something called volume trauma. So you want to be careful that the patient is not pulling a lot of large tidal volumes. Again, practically we may allow this for a short period of time, but you want to minimize the volume trauma as much as you can. So this will be an easy fix to this problem where there is a lot of air hunger. But remember, you have to treat the underlying causes, because that's really the real treatment. All other stuff is temporizing measures. Here again, you decrease inspiratory time by increasing flow rate, or by decreasing the whole respiratory cycle by increasing respiratory rate, or by switching to pressure control PC mode.